I will share how I increased my therapeutic efficiency up to 86%, reducing the average treatment span from 25 to just 3.5 sessions for one specific intervention, which I call addressing the spiritual origin of issues. This means switching to the integrative outlook, which is what I'm going to talk about today. Besides what was previously mentioned, I had the honor of researching perception development and energetic handling under the supervision and guidance of my teacher, Jose Bujaude, who accompanied me until his passing for 18 years. This led to the progressive development of dynamic integration, which is a method for transcending rational thinking and widening our perception, accessing an expanded state of consciousness in which we can willingly act on the spiritual field for the greater good. Dynamic integrated expanded state of consciousness, or DISC, is a specific spectrum of expanded state of consciousness that enable us to broaden our perceptual capacity and develop superior mental skills significantly. And finally, this is the last definition for today. Dynamic integration therapy, DIT, is a psychospiritual approach based on accessing that state to trace the origin of symptoms in the spiritual field and channel the unique intervention each case requires for its resolution. The key here is that we trace the origin of symptoms. Okay? Although I am discussing spirituality, I will refrain from engaging in a religious debate. But I would address the origin of the term religion, which is religare, the Latin word religare, which means put back together. Back together what? What do you think it is, asunder? I believe it is, or maybe it is, consciousness and energy. When I talk about energy, I mean the quantum waves, which Anna was kindly speaking of yesterday. And maybe what was asunder was how do we mold reality with consciousness? Okay, that's at least my point of view. Psychosensitive perception is often seen as a natural gift bestowed upon only a few. But that was not my case, not at all. But I was perseverant enough to endure a 2-decade-long training because I had an uncommon certainty. I went through death experiences being a little child, and that felt like being abruptly and instantaneously thrown into the spiritual reality. Then I knew that accessing it was possible, but of course I needed to find a more functional way to do it, one that could be responsibly taught to others. I said that already. Okay. When it comes to working in psychic development, understanding the enormous responsibility we face must be considered a matter of extreme importance. I researched for 20 years through trial and error to develop a method capable of minimizing the risk of destabilizing the psychic structure while simultaneously providing effective access to the spiritual field. Spiritual or quantum, or call it the way you want. I am only speaking from my own experience. Okay? The result is the 10-step path for personal development of consciousness on the dynamic integration therapist training course. Anyway, I suggest it could be worthwhile considering voluntarily expanding our state of consciousness as a valuable means to enhance both professional performance and personal benefit. First of all, even though I don't intend to present scientific research until I have other therapists' results fully processed, upon comparing my previous treatments, I noticed that cases treated with dynamic integration resulted in 86 faster than previous one. Resolutions without relapses had increased 78%, and one session resolutions became 15% of cases. This is completely unintentional because from my point of view, the first session should be addressed or should be used for collecting anamnesis and establishing rapport. But it seems that sometimes people are ready to hear, and they need nothing more from me. Then, more benefits are restoring interconnectedness awareness, which is an important one, reaching the patient's unconscious or accelerating the precise treatment attending to the origin of symptoms, furthering higher mind skills, accessing the universal counseling, powering our creativity, acquiring resourcefulness, granting emotional balance. Dynamic integration in context. Okay. Last March, I attended another conference in Bangkok, and it was so inspiring that it seems that we were all speaking about the interconnectedness as a primary necessity for psychospiritual healing. And its absence was identified as the leading cause of suffering. Our individual consciousness perceives itself disconnected from everything else, and even from our own spiritual essence. As a result, we suffer from separation anguish, just like babies. Existential void, we ignore our most profound yearnings and are therefore unable to satisfy them. In this connection of our consciousness and soul, or call it essence, or call it higher consciousness, or quantum level consciousness, throw us into an experience that we do not understand. What is the sense of life, or how do we make it right, are uncomfortable mysteries for our rational mind, but very well known by our soul or our essence. Therefore, when we restore the interconnectedness, the patient's life experience radically changes. Both scientific and traditional approaches support this perspective. I am grateful to Luciano Pulido, who explained the theoretical framework underlying the unity of conscious reality. So I will only quote Professor David Bohm, clearly aligned with the Hindu concept of Maya, who stated the notion that fragments are separately existent is evidently an illusion. And this illusion cannot do other than lead to endless conflict and confusion. I agree. Besides, Roger Penrose, in his orchestrated objective reduction theory, says, theoretically, when you have a heightened state of consciousness, it's because you are dealing with quantum level consciousness. To achieve this, we must overcome biological, psychological, cultural, and spiritual factors that restrain our perception. With some training, I can say, we can develop extraordinary perception, discovering an underlying field brimming with all information. We might become aware of subtle pressure changes, electromagnetic waves, different vibrational frequencies, our own and others' sensations, emotions, ideas, and even spiritual stimuli, all as a continuum. The foundation that supports the effectiveness of dynamic integration therapy is giving back control to a true power that actually can generate complete transformations, resulting in profound and lasting healing. It is not my concern to define this power today. And you may choose to believe or not, name it as you wish. I can only testify what I work with from my own experience, direct, personal, and subjective experience. I know that from my personal limited perception, I would never devise the precise intervention each person requires each different day. But there is a bigger intelligence that we might call the universal consciousness or the quantum field, however, that simply knows. It doesn't suppose like that. It simply knows and can manifest the best if we willingly allow it. We need to build such a strong decision, so strong for changing reality. Okay? I believe it is the magical communion, or the willingly established conscious interconnectedness between the consultant, the therapist, and the spiritual council that has the power to transform reality for the greater good. Aligning our personal conscious will with the spiritual source, we may tune in to the healthy vibrational frequency that expresses the cube. This here. Yeah. Dynamic integration therapists are trained to trace the deeper origin of conflict in the spiritual field. Then, in turn, we guide patients to access it as well. Here, the individual consciousness becomes aware of its spiritual life, and this is per se a profoundly healing experience. Subsequently, we support the patient in actively building the unique resolution that their spiritual essence needs at that level to restore interconnectedness. Once the unity of consciousness and essence integrates the precise learning that trauma had impeded, the spiritual quantum level, at the spiritual quantum level, the entire structure is completely reorganized, and you can see it. It's like, and it turns into a new shape, allowing symptoms to resolve naturally, because the cause has simply vanished. It changed. When we change the spiritual reality, which is the task of our consciousness, the ill structure becomes a healthy one. It is widening our state of consciousness that we can allow the precise intervention each person, each day requires. Easy to say, but not that easy to do. The task is so demanding for the therapist that our rational thinking skills would never raise a challenge. Thankfully, we can access enlightened state that enable us to channel higher guidance and perform spiritual healing with ease. I say, I have learned to sometimes stand on the wave and surf it willingly, but I am certain that the sea's power is not mine. Okay? This is an important factor to take into account. Anyway, as a psycho-spiritual healer, I do not treat illness at all, not psychic, not physical, not at all. But we are used to witness the regard of the remission, of diseases as a common side effect of spiritual healing. At the practice, I generally have no idea what will transpire during sessions. I have patients who jump and scream just to toilet, talk to that, or even die and come back to life. Fortunately, some are very quiet too. And I have no idea of what am I going to do either. Okay. Tuning in to the spiritual quantum field, I see the trauma that caused the problem as a present reality. Then I'm generally shown a possible way of solving it, but it's worth nothing if the person doesn't take his own responsibility, because it is their issue, not mine. Okay, so I need to support the patient and be there, just supporting for them to actively build their own way of solving, of going over what they couldn't before. Okay? In my opinion, we're on the verge of glimpsing the practical uses of consciousness' infinite power. Its true implications for life have not seen the light yet. Meanwhile, molding reality, communicating with death, or being instantaneously revealed what to do or say will remain dubious. I was even insecure myself at the beginning, and it took me several years until I surrendered to a simple, unbeatable fact. Symptoms subside quickly and almost without relapses, and people are happier. What else can I ask? Cases. This is a long one, and as you know, time is tyrannical, so I will try to go fast. The important here is that my patient, Mrs. A, a 60-year-old female with a history of major depressive disorder and panic unexpected disorder, consulting for outstanding hours that impede her speaking or acting. The loneliness she perceived as her life's failure, irrational fear of cancer, and fear and risk of inheriting multiple disease, which is a blood disorder, isn't it? Thank you. Okay, the important here is that the anguish associated with death and loneliness were treated on the second session, in which the origin was settled as a traumatic death led by an ancestor, a female ancestor. No, I died, a male ancestor. On the 6th generation, let me read this part. The origin is traced in an inherited trauma led by a male subject belonging to the 6th generation on her paternal line. By floating back to the scene, she repossesses the ancestor's lonely agony, including his disease. I must say, this is a very strong woman. Not everyone has this kind of healing experience. At the moment, I see she bends forward on the sofa, tumbles down, and remains still without breathing. My intervention was saying, Thomas, God calls you to his life by your name. Don't hide from him. Nothing happened. I repeated the phrase twice, and then he upright radiant. I'm sorry for my basic use of English, so I get lost. Please concentrate. Thank you. Okay.
Very good.
Thank you. Finally, her upright radiant and answered with a deep tone of voice, I completely surrender to God. With some support, he can forgive himself, which is normally a crucial factor. We need forgiveness for ourselves and for others to ascend. And finally, he elevates. My patient returns abruptly on her own, and she is shining. She takes a deep breath, and so did I. And with her own tone of voice, she says, freedom, peace, thank you. Next session, she just wanted to have a friendly little talk. And next session, when we checked results, the outstanding anguish was gone. so the feeling of loneliness, she did not bleed, and fear of death was lowered. The first session, changes remained stable, but some fear of death remained. So we worked on another death, a traumatic one, settled as the Brillenberg disease origin. She goes across it again as a mother who bled to death giving birth. And the last session, she shows up terrified because she bled. Then she feels her embodied grandfather coming to deliver a message, which I translate as, put our ancestors in order. I ask her to grab all the blood and return it to his owner. So a gangly, skinny young woman appears, but she's invisible to the family. She is the one who was abandoned, bleeding to death when giving birth for being an extramarital son. So she was raging, claiming to be seen. My patient demands everyone to look at her and bend the knee and ask her forgiveness. The family recognizes her and finally gives back every single drop of blood she was taken up from. And she nourishes herself. Then she hugs, everything happens at the spiritual realm, okay? She hugs her unknown daughter, and finally she's able to elevate. Discharged, my patient's symptoms were gone, and she did not bleed again. This was 3 years ago. Mr. B, where are you? Here. Mr. B is a 29-year-old male with a history of asthma, specific phobia of onions and repulsive smells, generalized gout psoriasis and anal fissure surgery, apparent cancer surgery, generalized gastritis, panic disorder, and substance addiction. It should be also mentioned that her sister had committed suicide and he sold drugs. He presents for consultation for the psychic aspect of her gout psoriasis and generalized anxiety. He has a practical, controller, rational kind of personality. So the first session, we process a trauma inherited from his paternal grandfather who unfairly lost his fortune with neurophysiological trauma techniques. But I noticed something was missing. So I guided an internal trip to his unconsciousness, and there he finds himself as a boy. But the terrified adult cries because he does not want to release control. I suggest he let both identities look at each other and see what happens. Finally, the grown-up, healthy, recognizes the boy was right, and he allowed himself to float on the sea, relaxed, as he said, as I've never been in my whole life. Thereafter, a sensation in his left arm with most psoriasis development still remains. So, we apply a pain erasing technique until it is gone. But the idea of injustice still irritates him. I pay a lot of attention to physical sensations related with emotions. Those are the most important symptoms for me, and are those that allow me to conduct people to the inner world and to the spiritual field. Okay? If I go through the mental field, it is just impossible. Okay? So those are the most important symptoms for me. We work on hemispherical connection, and we process a sensation in his belly associated with grandfather psoriasis and gastritis. Results checking: psoriasis improved. He allows relaxation, he feels positive. From the 2nd to the fifth session, we practiced only oral therapy. My impression is that he was cured in the first session, but he needed 4 more to believe he was. I understand him because I'm a rational mind too. These things happen, yes. Results checking, psoriasis and anxiety are cured. And additionally, he also stopped selling and consuming drugs. Fast processes. I would like to share examples only here. Yeah. Are the ones I want to show? Okay. Mrs. C is a 42-year-old woman with a history of brief psychotic disorder, which she avoided mentioning. And during a workshop, I suddenly felt thrown off my place, and I rushed over her, and to my surprise, I stuck her forcefully on her back. At that moment, I saw her soul incarnate in her body. Finally, she thanked me deeply, saying she had recovered the lost sensation of being truly here and now that had been missing for years. Ms. D is a 34-year-old man with a history of asthma, panic disorder, substance addiction, and generalized anxiety, consulting for psychological difficulties with breathing and the inability to cry. I just suggested, well, actually, I saw it. He was, how do you say, he drew when he was free. And his uncle had took him out of the water. So I just suggest, let's go and return the security that the boy needs. He needs to feel confident again. So we did, and that was it. When patients can consult with their families, the information, it strengthens the therapeutic alliance. Because we need to believe, we need to be certain to produce the profound conviction of being healthy. Okay? I had another patient, for example, who had to go to his mother and ask, was I going to have a twin brother? The mother said, yes. And what was going to be his name? So the mother said, Diego. So when she checked that what I had told her was right, then she cured. Okay? So I don't treat illnesses. They do. Miss E is a 19-year-old girl who attended a workshop. Noticing her anguish, it happens that was just they come out of my mind. See, I do things and then I understand what happened. And this was for me the most difficult learning, to let control go, to allow something bigger express through me. So I just said, you need to forgive your 9 years old girl. Otherwise, you won't be able to be happy again. I have met her for 15 years, so there's something else going on here. She burst into tears, saying that is absolutely impossible. So I suggested to step the little girl in front of her and look at her eyes, and then enter through her eyes to connect with her soul. And when she finds her brilliant, loving, shining soul, she recognizes she is a good person. And she was pleased. She said she had fixed her self-esteem as she had never had it before. So that is an example of the precise intervention, which is absolutely different for every different patient, every different day, with every different problem. Okay? Concluding, that's it. I aim to contribute to restoring the unified perception that we have restricted and to spreading the integrative awareness that can promote collective health. By accessing expanded state of consciousness, we develop a more harmonious state of living, aligning with our spiritual essence. Dynamic integration therapy provides safe and easy access to the universal consciousness, which attunes universal harmonious healing flow for the greater good. Because it is not my benefit, not their benefit, it's something else's benefit. One that involves all of our benefits, the good itself, I would say. Consequently, leveraging spiritual counsel may prove to be a promising method that still has much to contribute to holistic understanding of health. Moreover, the integrated state of consciousness awards us with a strong sense of harmony and faith in the existence, which can bring the best of us out to the world. My final intention today is to deliver a message of empathy. Once we experience our unity with others and with everything else, our survival instinct prevents us from harming it. Then, by developing integrated consciousness, we could potentially influence future generations to reduce aggression towards one another, towards other species, and towards the planet. Therefore, I encourage all of you as communicators to spread the interconnected concept that can contribute to socially collaborative coexistence. I believe this is what really dynamic integration has to offer. Thank you very much. You can scan the QR code and you have there all our information. And then you have bibliography here. I don't know if someone is checking it. So, anyone has any questions? Yeah, sure.
More than a question, I want to congratulate you. Okay? And to say thank you for bringing this kind of presentation and this kind of information. I don't think that we can understand this if we are not familiar with the scientific part of the new science, quantum physics. You had a list of persons that you use to support your way of thinking.
Yeah.
Okay, and I saw a lot of persons, very important within science, that were supporting this kind of presentation. So I saw that it was John Archibald Wheeler, Roger Penrose, it was Carl Jung, and it was Ponnen. So a lot of them that can give contribution to our understanding. If we want a holistic way of thinking, when we are treating a person, we cannot live outside of this kind of equation, consciousness and mind, as the origin of anything that we have. Thank you for that.
Thank you very deeply for saying that. So, I would like to thank you.
The monitor.
That's it?
Yes.
Okay, thank you.
Thank you. Thank you.
Thank you very much.
Well, Dr. Anna Forbes